this is a place where some people will spend their final days, home away from home. We're at the Hospice at MayCourt, and Gerard Yetman is the Executive Director here. Gerard, how does somebody get admitted here? How do they come to spend their last days here?
Well, referrals to the hospice can come from any place in the community. It can come from the patient's family member, a physician, friend. We don't have any limitations on how people are referred. Our process is, upon referral, to go out and do an assessment to see if the person reaches the criteria and the services we're able to offer, which pertain to the last weeks of life.
But it's got to be difficult, I would imagine, that, you know, even though you accept adults of all ages, there's got to be a growing number of people with an aging population who are looking for this type of care.
Well, most definitely. You know, we have seen an increase in referrals, especially over the last 6 to 8 months. The aging population is certainly you know, making an impact on all health services throughout our region, especially our hospital services. So, unfortunately, we're not a long-term care facility, so it's very important for us to go out and do our assessments to make sure people meet the criteria so that we're able to help the families in that last weeks of life.
And are you mostly government funded?
No, unfortunately, the least amount of funding we receive is from the government. Our government funding is directly associated with our nursing care. Our nursing care actually costs us $950,000 a year.
Wow.
And the government contributes $540,000 a year. So for our total program of $2.3 million, the government really only gives us 28% of our overall funding.
So how do you do it?
Fundraising. Like on May 3rd, we have Hike for Hospice, which is one of our largest events, and where the community goes out and walks and raises money. So we usually raise about $350,000. Which is a huge contribution to our $2.3 million budget each year.
In terms of, when you compare, obviously, you know, if you're in a facility that is in a hospital, that's government funding, it's health care.
That's correct.
How do the costs of taking care of somebody in this environment compare to that of a hospital?
Unfortunately, the hospital care is the most expensive care we have in our health system. People in palliative care in hospital range in costs from $800 to $1,200 a day, which is directly paid by government in full. The most cost-effective form of service is hospice palliative care in the community, which the total cost is $300 a day. But unfortunately, the government only gives us $156 a bed a day. So we are constantly using up a lot of valuable time in fundraising when more time should be going into direct care.
It seems like there needs to be a shift in thinking away from a hospital-type model, perhaps, especially with, as we talked about, the aging population and more people going to be finding themselves in need of these kinds of services.
Well, most definitely, because the focus of hospice palliative care also has to be not only on the patient, but also has to be on the family. For most families, this is the most difficult time in life. At least with a community program, there's other services. There's respite services for the family. There's family support counseling, which we have over 300 people in counseling. So we're able to follow the families to make sure that they cope well, that they're able to get back into the workforce, because many families take a lot of time away from work in order to care for their loved ones. So while they're in the hospice palliative care in the community, they have support services and are much healthier and able to get back into their regular life once when their loved one has passed on.
Marg and I talked a little bit about the volunteers, but clearly after talking to you about the funding, you couldn't do this without a team of volunteers.
It'd be impossible to run an organization and the 4 programs that we run without volunteers, because volunteers bring in about $1 million worth of services a year that we don't have to pay for. And that's home support, day support, hospice support, the cooking, the gardening, the cleaning. So it's their most valuable resource we have.
Mr. Yetman, thank you very much, and we'll of course have some more information about the hospice at MayCourt and of course the fundraiser that you're working on for May 3rd. Thanks very much once again.
Thank you.